I really have seen a lot of benefits in my patients and even in my family. My son lost weight, my brother lost weight and reduced his medications. So it's really very useful. It's like a treasure that I found that, you know, that I want to, share with people as much as possible. As something very valuable, that something very helpful that you just want to share it to as many.
Okay, hello and great day to all the viewers and podcast listeners of this Low Carb Health Doctor platform. So, for this episode, we are honored to have with us as a valued guest another doctor who is an internal medicine specialist. More specifically, he is a gastroenterologist by profession. And he's been practicing for the past 20 years. And may I welcome to the show Dr. Ramon Yap. Ramon, would you like to say a few words as an introduction to our audience?
Hi, good day to everyone. I'm Dr. Ramon Yap, and I've been invited by Don here in his podcast, and I hope that what we will discuss today will be of learning to many people.
Okay, thank you, Mon. Thank you for accepting my invitation to guest in this show. So, you are a doctor. And I admit that I may have some kind of bias, for interviewing doctors, especially with this, let's say, advocacy with regards to low carb. Primarily because for me, doctors and health professionals who are also doing low carb as a lifestyle are, it's like I'm sure before you have prescribed it and applied it to your own self as a lifestyle and thereafter significantly followed it, there should be some medical reason why in the first place you ascribe to it based on your own medical knowledge as an internist. So may I ask you, since when have you been doing this low carbohydrate healthy fat lifestyle of yours?
I think I started around July 2019, around the second week, because during the first week of that year, we had a reunion with my medical technology classmates, and one of my classmates lost like 25 kilos in 6 months, and he was also my roommate during that reunion in Surigao. And he shared with us what he did, and he said that he walked 13,000 steps a day and did the low carb way of eating. So when I got back from Surigao, instead of eating a piece of toast every early morning at 4 o'clock, I decided to just drink black coffee and then plan to eat at 8 o'clock in the morning, because usually by then I would be very, very, very hungry by 8 o'clock. But it so happened that I was able to go at around 10 o'clock before I really ate. And I guess I jump started to the 14-hour fast and followed the low carb way of eating. And then with regards to the step, I don't think I targeted 13,000. I think I targeted just 7 to 10,000 steps per day.
Walking?
And then, steps. The whole day steps. Whether you walk in the morning or as long as you try to have a total of 7 to 10,000 steps in a day.
You have this app in your phone or some kind of device that counts the number of steps?
Yes, more or less. I think more on the watch and cell phone. Tech things, technology. Yeah.
Okay, so are you now doing just low carbohydrates, or are you also doing fasting, or just
Yes, basically, yeah, I do subscribe to LCIF, meaning low carb intermittent fasting. So within 3 months, I already saw some weight loss, and BP was creeping up already, and it went down, and then my blood sugar level, my triglycerides, years before that were not so good, and they started to improve. So I got encouraged by what I was doing and started to read.
so
And maybe as a doctor, I'm just like, when you're hungry for knowledge, and I am into Amazon Kindle. So I kind of bought and read a lot of books in the last 3 years.
so at that time, that was 2019, so that's something like uh, three years exactly, more or less 3 years ago, right?
Yeah, yeah, a little more than 3 years.
Uh-huh. So as you said, you first came across that because a classmate of yours was doing it, and I'm sure you had some, let's say, apprehensions doing that in the first place at the outset, because like we're both doctors, and you know how we've been trained to look at nutrition in our medical curriculum. So what what actually at that time motivated you to start following what your classmate was doing, and what eventually made you adopt the low carbohydrate lifestyle? What was your motivation at that time?
I guess it was the weight loss. Yeah, because I was around like getting to like 76, 77 kilos at that time.
Uh-huh.
And, I wanted to be healthier. And I just actually just tried that. Not sure where it will lead me. But around that time, I also really like watch Nina Teicholz's Big Fat Surprise lecture. And then
Excellent. Thank you
I
po.
read
Magandang gabi po,
already
kuya.
got to read some of the Jason Fung books and his lectures. So it was like it kind of went together. The what I was doing like a trial thing, and then the knowledge also was I was also accumulating some knowledge about fats, about some realities that are kind of hidden from us because of the narrative or something. Yeah, so I don't think I had any apprehension I would say big fat surprise of Nina Teicholz was kind of big help for me because I got rid of my fear of fat with that, and also with the other doctors, the other practitioners of the low carb community. I got to learn from them a lot.
I'm sure it initially it wasn't that easy for you, knowing that from medical school, or even perhaps even before medical school, even during pre-medical courses, and even in earlier in high school, we've been taught that fat is, some evil thing,
Yeah.
and it's supposed to elevate your blood pressure, and it's supposed to be causing heart attack and stroke and all that. So, like what you said, that book by Nina, they calls The Big Fat Surprise, was a big help for you. Is that right?
Yeah, yeah, because that dispelled a lot of the fear of fat. Yeah. So after that, but I did not really go into, I would not say like a high fat diet. I was just looking at my carbohydrate intake. So I would say I was a low carb practitioner, and I just ate vegetable and protein and fat, but did not really count what I was eating in terms of the other nutrients. I was just concerned about eating less carbs, like eating less rice and avoiding bread. So basically, I just started with that. And then, of course, through the years, I never stopped listening to lectures, podcasts, and reading books to support, what we are doing, because we also don't want to just dive into something that we don't have any knowledge about or something.
Yeah, definitely. I think I can relate with you about that because in my own case, when I first started it, as I guess I've told you that before, I have cognitive dissonance. That means it's like, this thing, it's been programmed in your
Yeah,
head for so long, and then all of a sudden you got new evidences that it seems like it's not the right thing in reality, and then you try to adapt a new paradigm, but then subconsciously you still know that you still have this apprehension because for so long, ever since you've been studying all these things, you know that this is supposed to be an evil thing, the fat is an evil thing, and then carbohydrates are okay because they're supposed to be part of the vegan or vegetarian diet and all that. So in my case, as a neurologist, we call that cognitive dissonance. And
yeah,
did you also encounter such a thing, like that cognitive
yeah.
dissonance initially?
I don't think so actually. For my case, I just kind of accepted. I guess because really one of the first thing that I saw was Big Fat Surprise, and then I just accepted that idea of Nina that we've been there was kind of some degree of misinformation, and then so unlike you, I don't think I had a difficulty accepting that I will go into the other side of eating more fat and avoiding carbohydrates. Yeah, I don't know if I'm lucky in that sense.
Probably, because I think that's good for you. I think in my own case, I had this really deep rooted belief that fat is really bad for us. It's supposed to be an evil thing because as I have shared before, my own father died of myocardial infarction of what we call heart attack. So all the while from that time onwards, I was really blaming fat as the cause of the heart attack of my father. When in retrospect, it now seems very clear that my own father had metabolic syndrome from the way he looks and
Mhm.
I don't know his labs at that time. You're a gastroenterologist, so I've really been, you know, waiting to ask you this particular question because as a specialist of the gastrointestinal tract, including the liver, I suppose uh, that's your forte. So, in terms of the metabolic syndrome, non-alcoholic fatty liver disease or NAFLD is really a very, very important association. And I think it's now becoming more and more known to the general public these days. Though I know of many colleagues and many doctors who are not that well aware of non-alcoholic fatty liver disease and its relationship to the metabolic syndrome. So, in your own case, what can you say about it as a gastroenterologist? And how is your experience with your own set of patients, perhaps in terms of this entity and its complications? What can you say about that?
Well, for a long time, the gastroenterologists were just waiting for the drugs to come out that they will be effective. And one drug in particular, obeticholic acid, was very promising. I have a cousin in the United States who is a gastroenterologist, and he told me about it and that it was promising. that it was very good for fatty liver. The only problem, I think, was the safety issue. It wasn't solved yet, so it's not available in the market yet. And it was basically, we're just waiting for a good drug that can reverse fatty liver. And of course, I was ignorant about the relationship. I would say ignorant about the relationship of metabolic syndrome and fatty liver and diabetes, and before 2019 at least. And after that, I read a lot, I studied, learned a lot, and then started applying it to my patients, the low carb way of eating, and if they can, to do intermittent fasting. And I have seen now patients normalizing their fatty liver, normalizing the ALT, that's the liver enzyme that gets elevated in relation to if there's inflammation of the liver. So now I see if the patient will follow the teachings of the low carb way of eating, and you can really see the normalization of the ALTs, and ultrasound finding of fatty liver is also normalized, or it disappears. And it's really kind of nice to be able to see that reversal of the problem. Because you know that, it's not only the fatty liver that will be affected, the rest will be affected also if the patient has elevated blood sugar, elevated blood pressure, the overall some degree of the thinking, the mental health, because it also improves. The low carb way of eating can also improve our mental state. So you see a lot of improvement in the patient, and it's really a good thing to be able to finally have this armamentarium to be able to treat the fatty liver without using medication, and not just treating the fatty liver, but the totality of the health of the patient is improved.
Do they usually go together? That thing you mentioned about ultrasound findings of fatty liver and those liver enzymes, the ALT, as you mentioned earlier. Do they usually, like, let's say when the ALT elevates, or perhaps even AST, do they usually go together with a fatty liver finding on ultrasound? What's your experience, and what's about?
Yeah, most of the time. Some patients go to me because of, or refer to me because of elevated liver enzyme ALT, AST, and then where they do an ultrasound and they're discovered to have fatty liver. And when they lose weight after a few months, then there will be reversal of those things. Yeah, and of course I also get the lipid profile, blood sugar, because you always evaluate for metabolic syndrome, and they would improve also together with the other things.
I'm curious, in your own practice as a gastroenterologist, how often do you see patients like those, gets referred to you for elevated liver enzymes, and then you suspect some fat liver disease condition going on, and then you do get to diagnose it as such, and then rule it in as non-alcoholic fatty liver disease, and with or in association or not with metabolic syndrome. How often do you encounter patients like those in your practice now?
It's quite often nowadays, because it's really getting more prevalent. Being overweight or obese and having fatty liver at the same time is getting more prevalent. So yeah, I do get it now more than before, and I'm just happy that I can now truly help a patient instead of prescribing drugs that are not necessarily very good in terms of the ability to reverse the problem. So I'm really happy with that, with this situation, that I'm really able to reverse the problem of the patient.
That's nice to hear, and that's quite amazing. Because I can relate to what you're saying, because before, when I was not really that well aware of this metabolic syndrome and all its repercussions, in my own practice as a neurologist, I see lots of stroke patients, and before I just take it for granted that they have that stroke as a complication of hypertension and
Yeah.
atherosclerosis and all that. And then after I became aware of this metabolic syndrome, and because as I mentioned already before, I myself got metabolic syndrome. I diagnosed myself and reversed the process. It's like first-hand experience for me. So after that, I got awakened to this to these truths, and I began applying them to my own patients, to my own set of patients. And it really was very I was really very surprised when I was reviewing all my outpatient stroke patients. A lot of them have metabolic syndrome. It's like before I wasn't able to diagnose it. And in fact, even after they had a stroke, even when I was doing secondary stroke prevention with all the medications, a lot of them still weren't really that improving well, and the risk factors were still significant. But then when they started applying low carbohydrate diet in their own lifestyle, a lot of the laboratory parameters indeed improved. So I just mentioned that in relation to what you told me about non-alcoholic fatty liver disease. And yeah, in those patients with metabolic syndrome who had stroke, a lot of them have fatty liver disease. I used to think that AST and perhaps ALT rather, and perhaps to a certain extent AST is, I used to take it for granted that they're like elevated to the 50s, 60s, 70s, and then I just tell them, never mind, sooner or later it's going to probably come down. So I was not really addressing it that much because in the ultrasound, there seems to be no abnormal finding. Is that correct? There are cases wherein AST is elevated, but ultrasound does not reveal any abnormal pathology in the liver, yet it's already a beginning sign of fatty liver disease. Is that
Yeah, that's very much possible. Yeah, because the ultrasound is a subjective uh, procedure, so it's very operator dependent and machine dependent. So it's not necessarily that the sonologist will be able to find it. So it's a normal ALT cannot totally rule out the presence of fatty liver. Maybe a fibroscan would be a better test. Yeah, but it's kind of expensive at this time, so not many people have it. And with regards to the point of metabolic syndrome or elevated ALT, actually, I think we did not know what to do about it also. That's why it was not being taught because there were no good drugs for that. Like triglycerides, the phenofibrates are not really very good for elevated triglycerides. So there was it's kind of like there's no point in knowing the presence or absence of metabolic syndrome because we couldn't do anything about it before. Now that we can do something about it, then it makes sense that we look for it because we can treat it well. Really, really treat it. Not like the way we treat other things, like it's like more of a palliative thing, or we're just suppressing the symptom of the problem. The way that we do it with the low carb is really reversing the underlying problem, which is mostly insulin resistance. So that's why now it makes sense to know the ALT, whether there's fatty liver, whether there's metabolic syndrome. Because if you can't do anything about it, then it won't make so much difference, right? If you know it or not.
Yeah, that's I do agree with that.
Yeah, because like in LDL is the one that is being hammered to us because we have a statin for that. So all doctors, especially internists, are aware of the LDL because we have a treatment for that. But HDL, internists would have, a difficult time trying to explain to the patient how it can be elevated. So we don't look at HDL so much. We probably look at it, but not the same way that we are looking at it now, because now there's something that we can do about it now.
Yeah, that's a nice thing to be learning to acknowledge now in our own practice, especially now that we are aware of. We are sufficiently aware and perhaps able to address this metabolic syndrome in a more effective way. I'm sure you also have the same experience. So I think I remembered you telling me that you yourself have metabolic syndrome. Can you tell us more about it and what was your experience?
Yes, many years ago, I think I already had metabolic syndrome also because of my love for soft drinks. I would eat donuts before during those times. And now, I don't have metabolic syndrome, and I actually feel 10 years younger than my age because of the benefits of doing a low carb intermittent fasting way of living. And it's really kind of mind blowing to be able to, you know, reverse your health problems. I really thought that, I was just waiting that I will become a diabetic, like have a prostate enlargement, and, at 65, 70, be on 3, 5, 7 medications. And now I'm looking forward with reaching that age and see whether I will be on any medications. Because right now I really don't have any need for that.
So you mean to say right now you're not taking any medications anymore? You used to be taking
Yes,
medications.
actually, just vitamins.
Uh,
But as you grow older, you would expect, because a lot of my classmates, batchmates, friends, relatives, oftentimes when you reach 60, 70, you will be on maintenance medications. Yeah. So I expected that. Yes. And I don't like needles, so I really feared becoming a diabetic. So thankfully, I think I will never become a diabetic with the way that I'm eating the low carb way. Yes,
Yeah.
and fasting, of course.
But you are following your laboratory parameters, I suppose. Your laboratory test.
Yeah, yeah,
So,
yeah. I used to take my lipid profile like every 2 years because of my fear of needles. But now I do it every year, or sometimes twice a year, because I'm also curious as to the changes that are happening. Because I don't want to just rely on what I can see in terms of the blood pressure, my weight. I also wanted to verify internally in terms of the blood works that things are really okay.
yeah, there's this one particular concern, which is to a certain extent really valid based on how we've been trained as physicians before in terms of laboratory parameters that patients are, getting, including my own laboratory parameters, because a fellow colleague physician once told me my LDL is high. And then, but
Okay.
my triglyceride is very low now. It used to be very high, like it almost reached 200. I think the highest I got was 199, and my HDL was low. It reached as low as in the 30s before. But now my
Mm-hmm.
triglyceride is like my latest triglyceride is in the 60s, and this is the first time ever that my triglyceride level is lower than my HDL or good cholesterol level. My most recent HDL level is almost 70, and my triglyceride level is just a little more than 60. So it's like if you do the ratio triglyceride over HDL, it's
Less
like
than one.
less than 1 already for the first time in history. In your case, but my LDL was kind of elevated. Like if we base it on the NCEP criteria, National Cholesterol Education Program, many colleagues, physicians would say that I have hypercholesterolemia because my LDL is high. How about yours? Did you find any, tendency for that in your own lab results?
Yes, for me, my triglyceride divided by the HDL, the good cholesterol, that's the triglyceride HDL ratio. And it's supposed to be, I believe it should be less than 2. Less than 3 would be nice, but I think less than 2 is the more ideal ratio. And I used to have a 5. And yeah, my last two takings this year, I'm less than 1. So I went from a little more than 5 to less than 1. But my LDL is elevated. That's why I'm very thankful to Dave Feldman. I'm not sure if the listeners know him, but he's a software engineer. And he kind of found that there are people whom he calls the lean mass hyperresponders who can have elevated LDL, but very low triglyceride and even high HDL. So when I compared myself to these people, I'm very close to being a lean mass hyperresponder. Yes, and physically, yes, I'm approaching even that, in terms of my physique. My waistline is getting smaller and smaller. Unfortunately, my butt is also getting smaller and smaller, which my wife doesn't like. But in terms of being afraid of having a heart attack because of an elevated LDL, Dave Feldman has somehow given me the assurance. They just came out with a study that people with elevated LDL, if the ratio is very low, that probably you don't need a statin. Mm-hmm. So I'm not. I've been in the residency training program. I'm telling the residents, can you find a heart attack patient who has this ratio of less than 1 and the BMI is very, very good, and this patient had a heart attack? Can you please find me an example of that? Because the people in the ICU, the profile is very much different. Yeah. So I'm confident even if my LDL is elevated because of these lean mass hyperresponders, and it's a different group of people. Yeah.
Yeah, and I think I also remember Professor Kenneth Sikaris of Australia, a chemical pathologist who illustrated based on his studies that these people with elevated LDL with good triglyceride over HDL profiles are these LDLs, even though they are supposedly elevated, are the good kind of LDLs, not the
the fluffy kind.
The so-called buoyant kind of LDLs, not
large buoyant.
Yeah. So it's very comforting to know that these studies have already come out, and
yeah.
At least I think it's already high time for the societies to change the guidelines, like LDL, identifying LDL as the bad kind of cholesterol. I think it's already high time for the medical societies to revise the definition of the good and the bad cholesterol. Would you agree with that?
Yeah. Yeah, we should differentiate the large buoyant and the small dense LDL. Now, hopefully in the future, the test won't be that expensive. Hopefully. But for now, what I know is that the triglyceride HDL ratio is a good way of knowing whether you have the large buoyant or the small dense LDL. And of course, it's the small dense LDL which is more atherogenic. It's actually the culprit for the plaque formation, which of course starts with the inflammation. Without inflammation, the cholesterol will not necessarily attach to the vessel walls.
Yeah, I do agree with that. I do agree with that. It's like I think these ratios that you mentioned earlier, like the triglyceride over the HDL ratio, are really good surrogate markers for
Yeah,
the level of small dense LDLs or the atherogenic kind of LDLs, as you said. So,
yeah.
if I may ask you, Mon, from your own personal experience, what would be for you the most important benefits that you have experienced in a nutshell with regards to your adaptation of the low carbohydrate intermittent fasting lifestyle?
Well, based on the work of Benjamin Bickman, Dr. Bickman, insulin resistance is kind of hyperinsulinemia, insulin resistance. It's basically the root of many diseases that we are experiencing in the modern world. And doing the low carb way of eating and together with fasting can very much improve insulin resistance, lower the level of insulin in the body, and with that, you kind of, you're able to prevent or probably or even heal or reverse some of these conditions: prostate enlargement, polycystic ovary syndrome, diabetes, hypertension, dementia, and even like skin diseases. I used to have some skin issues, and now they're gone.
Mhm.
And the it's really amazing in terms of what are the effects of having chronic hyperinsulinemia or insulin resistance, and the many things that can be reversed by practicing the low carb way of eating. And during the pandemic, um, the one of the risk factor or comorbidities, the weight, right? The obesity was a big factor during the epidemic of the COVID-19. And if we were able to diminish or decrease the prevalence of obesity, then probably not so many people will have succumbed to the COVID-19. So I think for me, the lesson with the COVID-19 is we should take care of our body. We should try to lower insulin resistance and hopefully be able to deal with infections in the future.
Yeah, that was indeed a very big learning experience for physicians, that COVID-19 and its, let's say, tragic association with metabolic syndrome. Because the way I gather it, most of the deaths of COVID-19 are patients with metabolic syndrome and all its repercussions, right?
Yeah.
Uh,
Yeah.
so, what if you have any what message would you like to share to others about your own personal experience in doing low carb and with or without intermittent fasting, Mon?
Um, I really have seen a lot of benefits in my patients and even in my family. Um, I, I was able to. My son lost weight. My brother lost weight and reduced his medications. So it's really very useful, and it's like a treasure that I found that you know uh, um, that I want to share with people as much as possible. something very valuable, that something very helpful that you just want to share it to as many, which is probably why you're doing this, because you want to uh, help more people with this avenue.
Yeah. You hit the bullseye.
Yeah.
What you said, what you told me, you mean to say you successfully convinced your immediate relatives to also follow your lifestyle then. As you said, your brother's doing it and your son is doing it.
Yeah. Yeah, I do try to set the example, and that's why in terms of exercising, uh, sleeping, because I always try to because for me health, true health, the path to true health is sleep, stress management, diet, and exercise. So these four I really try to live by. Yes,
So
and be an example to many people.
yeah, I think the common denominator of those things that mentioned, proper sleep, what was that again? Proper
Stress management,
stress management and
diet,
diet and
exercise.
exercise. Yeah, I think that what I see as the common denominator of those is like the level of stress and anxiety in one's own lifestyle, right? I think it when you have chronic stress, whether it is physical or mental or psychological stress, it somehow elevates your stress hormones, your adrenaline and all that, and it chronically kicks in your sympathetic response, your fight or flight response, and that somehow activates your or rather that somehow promotes further insulin resistance, right? That you
Yeah,
agree?
yeah, yes, yes,
Uh,
yeah.
so I think that's quite a lot of things that you have shared with us and the audience of this show, Mon. But before we call it today, if anyone would like to connect with you or perhaps get in touch with you, consult with you, how may you be connected? Mind if I ask?
Basically, I just have my clinic in Polymedic Plaza and Capital University Medical Center. And by next year, I will be having clinic also at the newly built ACE Medical Center in Lapasan. So that's where they can get in touch with me. I don't have so much social media presence. I just go on Twitter to learn new things because the books are kind of delayed by 3 years. So it's in Twitter that you can, if you follow the right doctors, then you get to learn a lot. The new things that come out, you can already learn about it. You don't have to wait for 3 years. Yeah. So that's the value of Twitter for me.
And before we go, is there anything else that you might have I might have forgotten to ask you, would like to share to our audience with regards to this topic that we have talked so far?
Um, uh, well, there's probably I'd say that knowledge is power. So there are many ways to learn about this way of eating and confirm whether what we are saying is true or not. And because there's right now it's there's this issue of misinformation, and there are many other types of diet. So for me, for the audience, probably if you have the time, yeah, listen to podcasts, maybe read books if you can, if you have access to books, because knowledge is really key. I was able to confidently go into this after reading and listening to a lot of lectures. Yeah, but it takes time and effort. And probably, I hope that many, many more of our colleagues will, also do their own research so that we can be empowered.
Yeah. And much of that, I think, is self-learning, right?
Yeah, yeah,
It's
yeah.
not in
You
the
have
text.
to just be patient.
It's not in the textbooks yet, much of it, I suppose. So I'm quite sure everything that you have shared with us here in this show, Mon, would be very useful to all our audience, to patients and to medical colleagues also. So with that, I thank you very much for sharing your own personal experience and learnings about the low carbohydrate lifestyle plus intermittent fasting. And thank you very much for your time.
Thank you. Bye bye.
Subscribe to my Low Carb Health Doctor channel. Get notified of my upcoming videos by clicking on that notification bell, and see you next time.